Hi, my name is Kathy Bochnowski, and I'm a pelvic floor physical therapist in Park City, Utah. And I would like to take a moment to talk with you about the postpartum 6-week checkup. When your patients come back to see you, you're often discussing things such as any complications or concerns that occur during labor and delivery, or bleeding and discharge, birth control, how their sutures or any other issues are healing up for them. But I also think this is a beautiful time to capture when a patient might benefit from a referral to see a pelvic floor PT. So I'd like to tell you a little bit about what I do as a pelvic floor therapist. It will help your clients to have a more complete and faster recovery postpartum. There are so many things that we do that I decided to write down a list so I wouldn't forget anything. Pain. There are so many pain concerns that women have, anywhere from their neck and wrists down to their C-sections or pelvic floor. I have a lot of manual therapy skills to address all of these things to help them so that they can do what is most important, which is taking care of themselves and their baby. What about that pelvic floor weakness? So many women are told at 6 weeks just to work on the Kegel. A lot of the women that I screen are not doing that exercise properly. There's a lot of dyssynergia, so sometimes they think they're contracting and they're actually bulging down, or they're just so disconnected there's hardly any contraction there. Through using biofeedback and a lot of cues and time, I help them to learn how to do those exercises properly. Incontinence, both fecal, urinary, and with the urinary, I treat both urge and stress incontinence. This is so important postpartum because if they don't have the proper strength to manage closing off those sphincters and not leaking, they are likely also not providing the proper support they need to prevent prolapse from happening. Prolapse can happen during that as the baby's coming out of the birth canal, but it also is something that kind of happens over time, like gravity's effect on our bodies. So I do a lot with prolapse screening, education, and prevention. What about the diastasis? Very big word here. I always educate women on how to improve the proper contraction of their abdominal wall, pull that back so they're managing their intra-abdominal pressure and not getting that tenting or coning. Posture is so important because they spend all this time sitting and nursing a baby, so I want to get them up. I want to teach them how to do it right and have good support to heal their body, bring those pelvic bones back together. I also treat things such as constipation and symptomatic hemorrhoids. No fun. Constipation is also putting pressure downward on the pelvic floor. It is not healthy for them to be experiencing that, especially in the early postpartum phase. I want to help these gals get back to exercise safely and properly. I have a lot of different stories that I am fortunate enough to encounter where women go back to something that's too high impact too soon because they want to get that baby weight off, and it ends up causing damage to their pelvic floor. And I think a lot of what I do is prevention. I can help so that they learn how to move their body properly so that they aren't causing issues down the road. I'm always screening for postpartum depression and referring to the right resources for that as well. I like to use a lot of hands-on. I'll use biofeedback all the time, and everything that I'm going to do is only going to be supporting the great work that you did to help them birth their baby. So I feel that together we can really help women have the best outcomes possible postpartum. Thank you so much for your time. Again, I'm Kathy Bochnowski, happybodyphysicaltherapy.com. Thank you.